Cases are climbing once again. The risk factor here in San Antonio deemed worsening. So she is back. Dr. Ruth Berggren with the Long School of Medicine at UT Health San Antonio, infectious disease specialist. We're always happy to have you here, even though we are talking about climbing COVID cases. So we know that there's this new variant out there, BA.5. What do we need to know about the characteristics of this version of COVID?
So BA.5 is a variation of Omicron. It's now making up at least 50% of all the COVID cases in the United States. What has happened is the virus has accumulated more mutations in the spike protein. There's at least 30 different mutations. These mutations are expected. This is how viruses evolve. And what they're doing is they're making the virus more infectious, but also, luckily for us, they don't seem to be making this virus more lethal. So we're seeing a lot more infections. There's a real surge going on. And while hospitalization rates are slowly going up, we're not being overwhelmed by hospitalizations because the disease seems to be milder.
What does this mean for variations going forward? Do we fear that at some point it does become more deadly or lethal, or are they just going to continue trying to be evading our vaccines?
Right. Well, the way that natural selection works is that as long as viruses are replicating, they're always going to be selecting for the more advantageous mutations, which means that any mutation that makes them more infectious, that mutation is going to stick. That's not necessarily true for lethality. Not every set of mutations is going to make something more lethal, but it could happen. And so we don't want to see that happen. And as long as the virus is replicating a lot, meaning lots of cases are happening, then we run the risk of worse mutations coming down the pipeline. So we have a real vested interest in trying to put the brakes on this pandemic. And it's the stuff we've been talking about since the beginning, right? And it really, really is time to put the masks back on in San Antonio. And by this, I mean, if you are in an indoor public place, if you're 2 years old or older, you should have a really good, well-fitted mask on, at a minimum one of those surgical masks, or ideally a KN95 or an N95 mask when you're in public. And if you're not in public, you should also consider masking if you're taking care of a family member who has COVID, and that person should be masked when they're around you as well. So that all these measures that we've been talking about in the past, they apply now. And you just don't want to get a COVID infection. You're not likely to die from this BA.5 variant. However, you can get long COVID from it, and there's a lot of consequences to long COVID that we're just beginning to unpack.
Let's talk about boosters, because it's been a minute since a lot of people got their latest booster. So what is the guidance currently on when we may need another round?
Okay, so the data from Bexar County are showing us that while we have almost 1.5 million people that are fully vaccinated, we have a lot of people that haven't gotten boosted. And so if you have not had a booster shot, meaning your third shot, you should go out and get one. Now is the time. It's going to raise your antibody levels. Those antibody levels will reduce your risk of having a symptomatic infection, and they'll greatly reduce your risk of having to go to the hospital. Now, who should get a booster beyond that third dose? It would be anybody over the age of 50. So there's a lot of folks that have that are eligible right now, today, to get a fourth dose of the existing COVID vaccine to protect themselves better. There could be no better time than right now during this surge to go get your fourth shot. Some people have been asking me about elderly folks, the 88-year-olds and so forth in our community that maybe got their fourth dose quite a long time ago, and since it's been 6 months since they had that dose, should they go run out and get another one? We don't have guidance for that at this time. We are looking forward to hearing something in the fall about an Omicron-specific booster, and everybody should pay close attention to that and get out there and get in line for that one as soon as it becomes available to us. We haven't heard anything just yet, but we do think that this is in the pipeline. And then there's the little kids. Do you want to talk about them?
Absolutely.
You don't need us here.
Absolutely.
You don't need us here at all.
This
Yes.
is your show now.
We absolutely want to talk about the opposite end of the spectrum now. We know that kids 6 months and up can now get vaccinated. And of course, parents had a lot of questions, still have a lot of questions about that. So what have we seen with those youngsters who have been vaccinated so far?
Right. So I was just reading recently that over 300,000 little kids, 6 months and up, under the age of 5, have had the COVID vaccine, and we're not seeing any danger signals. So people should feel good about that. If you've been hesitating, if you've been on the fence as a parent about whether your child who's under 5 years old would really benefit from the vaccine, the good news is that we're not seeing any danger signals for this vaccine in that age group. And we have reason to believe that as our data get bigger and we get more numbers, that we're going to start to see similar protective effects as we've seen in older people with respect to protecting the little kids, especially the high-risk ones, from getting a serious infection, for getting complications like croup, or from protection from needing to go to the hospital. So the pediatricians that I work with are getting appointments to have their own under 5-year-olds vaccinated.
And so a lot of parents, I'm sure, with school just around the corner, believe it or not, thinking about the timetable there. Reminder, it's 3 shots for the little kids. So keep that in mind.
Yeah, I recommend that you don't wait until the last minute before school starts to run out and get the vaccine, because you need to get the series, and there's weeks in between each shot. So it takes a while to get completely protected. So the sooner you start, the better off you are.
Some of us may wait for school supplies and haircuts at the last minute, but maybe not vaccines.
Exactly, not vaccines. And with all these vaccines available to us, the youngest members of our community, what is the timeline now for quarantine? We've been through the pandemic for so long that it's constantly changed. Where are we at now?
So quarantine, just to remind everybody what we're talking about, quarantine is when you've been exposed, but you're not sick. If you're sick, then you isolate. So if you've been exposed to the virus, you don't have to stay home, but you do have to wear a mask for 10 days, a good mask, and you have to monitor your symptoms. If you don't get any symptoms, you can get a test at day 6. Don't get it before day 6 because it won't be as accurate. And of course, if you do develop symptoms while you're monitoring yourself, you should then stay home and then seek a test. And you can do a rapid antigen test, or you can go and get a PCR test at one of our several free test sites that are in the city. Now, don't just sit around if you have a diagnosis of COVID-19. If your test is positive, you need treatment. And here's a new development that you may not be aware of. It has now been ruled that pharmacists are allowed to prescribe the outpatient medication Paxlovid for patients.
Right.
Yeah, so you do have to show the pharmacist evidence that you don't have serious kidney or liver disease. That means bring your most recent lab tests and show the pharmacist. But they will look at that. They'll look at your other medicines and make sure there's no dangerous drug-drug interactions, and they can prescribe Paxlovid. Now,
Good to know. Dr. Ruth Berggren, I'm sorry we have run out of time, and you were always so full of information. But I know this is not the last time you will be with us.
We appreciate the knowledge. We appreciate it.
Take care. We'll see you next time.